Well, there's no doubt COVID-19 has disrupted our lives. The pandemic has contributed to mental health issues in the workplace and, of course, those of us who are working from home. Depression, stress and anxiety are just some of the things employees are struggling with. And they're claiming from their insurance companies in order to treat this. Myrna Sachs is Head of Health Management Solutions at Alexander Forbes, and she joins me now from here in Johannesburg to talk some more about these findings. Myrna, thank you so much for your time, as always. Now, we've heard since the start of even a hard lockdown since March last year, in continuous conversation with organizations like the South African Society of Psychiatrists, who pre-warned that there was a wave of mental health issues that was going to hit not just South Africa, but indeed the world, where everybody is dealing with the after effects, or indeed the ongoing effects of this pandemic. But the organization, the South African Society of Psychiatrists, have now officially reported that mental health is the biggest threat in 2021. And it looks like the research and the data that your organization is looking at now confirms that by saying that 60% of companies are experiencing an increase of disability claims for mental and behavioral medical conditions. Now, even though we were warned about this, this must have come as quite a shock to corporate South Africa.
Yes, thank you. Thank you, Marcel, and good evening to you and to your listeners. It has come as a shock to some. Other companies were actually prepared and made sure that they had employee assistance programs in place, whereas other companies were lacking. But I think what's taken everyone by surprise is also everyone in the beginning thought that lockdown would be for a short period. So they deal with it in bits and pieces without realizing that 16, 17 months down the line, we're still in lockdown and we still haven't gone back to work. And employees are struggling. And the problem comes in, it's not just the mental and behavioral, it's because of financial stresses and ergonomics in the home play, at home now also just pushes up the depression, the anxiety, the stress.
And what are you finding, or what would you say are the guidelines that companies should be focusing on? Because like you said, the issues are vast. We're looking at mental health issues, but also physical health as well. You've got John or Jane who thought they were going to be working from home for 2 months, so they've been sitting at their kitchen table on a stool on their laptop for hours, and a year later they're still sitting on that stool. Is it a company's responsibility to ensure that John and Jane have an ergonomically safe chair and desk to work on it? And is that something a company should now be budgeting for going forward?
Yes, so what we can say now is, from an occupational health and safety point of view, there's new legislation that's just come out, which actually puts the responsibility on companies to ensure that the employees actually have a safe place to work. So a safe place is either at home or in the workplace. So it doesn't mean that you need to go buy expensive chairs and desks and stand-up desks, but it's making sure that the environment is ergonomically safe and that you can use things from home to even make it safe. The problem is you can't sit at your dining room table, at your kitchen table forever. So you do need to make sure that, and it's not just chairs and tables, it's the environment, it's the sun shining on your computer, it's the noise, it's everything around that we need to make sure that our employees feel safe. And that also plays a part why people are becoming depressed also, because they just can't work like this anymore.
Now, things like that are almost black and white on paper, but a lot of it, especially if you look at mental health issues, you're talking about stress, anxiety, depression. We've seen an increase in domestic violence being reported as well, on top of that as well. Are you finding that companies also realize that there needs to be an increased amount of empathy in the way that they are managing staff, both those who have returned to the office and those who are still working from home?
Yes, absolutely. And what we also need to find is that companies are now starting to upskill their managers. Their managers are also employees and also struggling, but they need to be upskilled in how to actually be empathetic to the employees. You can't, as a manager, say to your employee, well, my problems are worse than yours. So you need to be able to know how to actually juggle being a manager and an employee, and all the role collisions that have happened as well. And we need to develop return to work strategies also. So for working from home and working in the office. And we need to make sure that you don't forget the people that are still working at home, especially if you've got a hybrid approach. So managers definitely are being upskilled, but more work definitely needs to be done there.
Now, we're talking about the data showing that there are increased people suffering from stress, anxiety, depression, and the list goes on. Then you've also got issues around this thing called long COVID. Those who've recovered from COVID-19 on paper, but are still suffering the after effects, physically suffering the after effects from it. And research continues to come out about it, but they're saying that this can last for almost 12 weeks, if not many more months. How are you suggesting that companies deal with the issue of long COVID specifically?
Okay, so from what we're doing with our clients currently, and what we recommend for clients to do is, if anyone has had COVID, is to send out a questionnaire. We've developed questionnaires for that. 2 weeks after COVID, then 4 weeks, then 6 weeks, then 8 weeks, send out a questionnaire to see if there are any effects. What's happening is long COVID is not just affecting those people who were in hospital or in ICU. People who are even asymptomatic are now developing fatigue, brain fog, and it's 2-3 weeks after recovering from COVID. So long COVID is definitely there, and we're picking it up in incapacity cases, absenteeism management. We're making sure what managers need to do is you need to be aware and don't downplay if someone says, I'm struggling and I'm really tired. Because what's happening now is people don't actually realize that they've got long COVID. They think it's just that they're not putting it together. So they're not treating the issues. So it's going for long. And you say 12 weeks. We've actually seen to a year, 12 months, 13, 14 months down the line. COVID is still. So, and that's going to be there for a while, unfortunately.
Okay, we're going to leave it there because unfortunately it looks like our line is not that stable anymore. But thank you so much for that. That's Myrna Sachs. She's coming to us live from here in Johannesburg. She's the head of health and management solutions for Alexander Forbes. A very, very interesting conversation there. And I think the point she would also make there is saying that in as much as companies need to be abreast of what they need to put in place in terms of policies in dealing with the after effects of the pandemic, the ongoing effects of the pandemic, that staff members and workers themselves also need to know what their rights are when dealing with these both physical and mental health issues that so many are dealing with right at this time.